most of the time, again, you are told during dispensing, you are told to dissolve one sachet in a certain amount of water, mostly in 15 mLs of water. You're even given a cup or something to measure the right amount of water, and then you stir the content. Leave this content for some few minutes to thicken. For better results, again, it's good to give esomeprazole on an empty stomach. These medications also have got side effects, so they are prescribed for a short time to babies. Welcome to this channel where we talk about the basic medical information making a difference. My name is Rebecca Morangi. For the returning subscribers, thank you so much. I appreciate your support. And for those who have come across this channel today, kindly consider to subscribe. What is the treatment of acid reflux after getting the correct diagnosis? How do we manage this? The treatment will depend with the outcome or the result. Gastroesophageal reflux many times does not need treatment. Gastroesophageal reflux disease needs treatment, but rarely does children need surgery. The first thing, most of the time, is what you call adding thickenings. Why? This comes as a result of course most of the things will be dealt with by the changing the foods or the feeding routine or adding something to the foods we give. When I mention of thickening, this one, some specialists rule out that when you add a thickening, will help to reduce some of the physical symptoms like spitting. But before you do that, you have to consult the pediatrician, because you may do this and harm your baby. Another treatment to this condition is what we call feeding pattern changes. Acid reflux can be managed by changing the pattern of feeding, either breastfeeding or giving formula. Breastfeeding can be done more oftenly at different intervals. The same with giving formula. But again, it's good to get in touch with maybe a lactation consultant or somebody who has got information or more information of feeding, especially in babies, or what you call breastfeeding medicine specialist. All these can help you to know how you can change the pattern of feeding your baby. Another treatment is what we call removal of cow's milk protein. And what may look as a reflux sometimes can be an allergy. So it means sometimes a pediatrician may recommend not to give cow's milk for some few weeks to your child, or if you're breastfeeding, you will need to leave what you call, or to stop taking some daily products from your diet for some time, not for the whole of your life, for some time, to be able to know whether it's protein which is bringing an allergy to your baby. sometimes which may confuse to be what you call acid reflux. So you can see how sometimes it's difficult to rule out this acid thing. Another treatment option is what we call medication. Most of the time, they prescribe what we call PPIs to children, what we call proton pump inhibitors, and these are strong, actually, acid blockers, and they are 90% effective, especially when it comes to when you have tissue damages. When you have what we call esophagitis, which is the inflammation, or your child has been diagnosed with esophagitis, which is a complication actually, where the lining, or your child develops some ulcers. That is what we call tissue damage. Now, proton pump inhibitors, they're very good because they promote healing. And most of the time, if you remember, or if you have come across any prescription from a specialist, they prescribe what we call esomeprazole 10 milligram. And most of the time, this comes in sachets form. And for you to get good results again, you should give the medication as per instructions. Most of the time, again, you are told during dispensing, you are told to dissolve one sachet in a certain amount of water, mostly in 15 mLs of water. You're even given a cup or something to measure the right amount of water, and then you stir the content. Leave this content for some few minutes to thicken. For better results again, it's good to give esomeprazole on an empty stomach. For you to get a good result, you should follow the procedures, or you should follow the procedure so well. These medications also have got side effects, so they are prescribed for a short time to babies. The last thing is what we call surgery. If other measures are not an option to this condition, then a pediatric gastroenterologist can advise you, especially on what we call laparoscopic Nissen fundoplication. Providers consider surgery in infants only on selected cases. And all this is done by a pediatrician or a lactation consultant, or somebody who has gone to a training, especially on breastfeeding. It's high time to look for help. Remember, babies cannot use words to explain themselves. That is how difficult it is. You are your baby's mouthpiece. Take your position and do it right. After getting all this, we can't finish this by not mentioning the complications of acid reflux in babies. Like another, like adults, acid reflux has got complications, and we dealt with this on acid reflux on the previous video. Kindly, you can get more info on that. Delay in normal weight and growth in babies. Remember, we said mostly when a baby or your baby spits during feedings, the baby cannot retain the required amount of nutrients to enable him or her to get the right weight as per weight schedule. So this is a complication brought about this condition. Another complication is what we call esophageal strictures. This is a scar tissue which is formed to prevent you from the inflammation. And this scar tissue brings what we call narrowing of the esophagus. At the end of it all, it will bring problems during swallowing and eating. Reflux esophagitis. Reflux esophagitis is the inflammation of the tissues of the esophagus. Mostly it causes some complications like ulcers, and this will need treatment. We have respiratory problems. Remember, we mentioned there is a connection between asthma and acid reflux. So if your baby happens to have a condition we call asthma, or your baby is asthmatic, this acid reflux will make it worsen. Can influx in babies be prevented? One, it's difficult, but one thing to do, make your baby to belch after feeding by patting behind the baby's back, because excess gas in your baby's tummy can cause them to spit. Another thing is to keep your baby upright for 30 minutes after feeding. Don't go straight to tummy time. Talk to your pediatrician on how to avoid overfeeding, because this can cause this acid reflux in your baby, or this can help you to prevent this condition. Up to this level, I believe you have gotten something. We have looked at the management or the treatment options available, which we have really tackled at length. We have looked on how you can prevent, and finally we have looked at the complications of acid reflux in babies. And all this brings us to the conclusion on this study of acid reflux in babies. We can do this better. We can prevent this, and we can help someone to get to the level where we are also by sharing this channel, or by sharing the link of today's study. That one shows that you are considerate. And also give us your experience on the chat box or down below on the comment section. And kindly don't forget to subscribe if you are new here. And for the returning subscribers, thank you so much for always checking on this channel. I love your company. Let's get on, or keep on lining together. Let's make a difference in somebody's life. Thank you so much. Bye bye.